Hello, my name is Suad. I'm a nursing student, and I'm going to be talking through the breast, pelvic, and andrologic exams. So throughout this video, I'm just going to be explaining the entire procedures, but I do want to note that for all of these exams, I would explain the procedure to the patient, ensure that they are comfortable, always wash my hands, put on clean gloves, and change my gloves as needed, and ensure that I answer any questions before and after all of the procedures. So beginning with the breast exam, we would have the patient in a gown that is opening in the front, have them drop the gown to their waist, and visualize the breast tissue with the patient sitting up just like that. Assess for size, symmetry, shape, contour, any skin changes or scars, and you'd want to do it from different angles. So you would walk around the patient looking at each side of each breast to assess for all of those things. Next, you would have the patient raise their arms above their head. You'd walk around to assess all sides for all of those same things: size, symmetry, shape, contour, any skin changes. Then you'd want to have the patient place their hands on their hips and press inwards to engage the pectoral muscles and assess for the symmetry and movement, and assess for any dimpling or asymmetry that would not be a normal finding. Then you would have the patient lean forward with their arms out to assess for the symmetrical fall of the breast tissue. Next, you would palpate the cervical, supraclavicular, and infraclavicular lymph nodes, then assess the axillary lymph nodes by supporting the client's arm to allow relaxation of the shoulder. Then you'd start at the inner aspect of the arm, palpating up the arm into the axilla, and then down the mid-axillary line until you reach the breast tissue. Next, you would have the patient lie supine, placing their arm above their head on the side that you are assessing the breast tissue. You'd want to palpate vertically along the breast tissue with the first 3 finger pads, and then palpate the nipple as well as the tail of Spence, which is along the outer part of the breast tissue that extends toward the shoulder. And throughout this, you'd want to ensure that you are being systematic and consistent with your exam and assessing for elasticity, consistency, any masses, nodules, indurations, any tenderness, as well as any nipple discharge. Moving on to the pelvic exam, you would want to position the patient properly, having them sit all the way at the edge of the table with a drape over them. Place their legs on the stirrups and gently lift the drape, of course letting the patient know. First, you'd want to inspect, so you want to visualize the hair distribution, the symmetry, any visible lesions or discharge. Then by introducing your touch with the patient, starting at their thigh, you'd want to palpate the inguinal lymph nodes, the mons pubis, the labia majora, labia minora, and then you'd want to also separate the labia majora to assess the clitoris and the urethra, as well as separate the buttock to visualize the anus to assess for any hemorrhoids or any signs of a sexually transmitted infection. You'd want to make sure that on all aspects there are no lesions or tenderness as well. Next, you'd want to assess the Bartholin's and Skene's glands, and by doing this, you would place an index finger to the first knuckle pointing downwards and compressing the tissue between 5 and 7 o'clock to assess for any pain and enlargement of the Bartholin's gland. Then to assess the Skene's gland, you'd want to rotate your finger so that it's pointing upwards and applying gentle pressure upwards at midline, and then removing the finger and visualizing if there is any discharge consistent with chlamydia or gonorrhea. Moving on to the speculum exam, you'd want to assure that it's adequately lubricated and that you're holding it properly with having an index finger always at the top so that it ensures that you are not opening it on accident as you are inserting it into the vagina. So you'd want to introduce your touch again, using 2 fingers of your non-dominant hand to separate the labia and visualizing the vaginal introitus before inserting the speculum at a 45-degree angle pointing down towards the coccyx, and then opening it until you can visualize the cervix. And you'd want to visualize the cervix for any lesions, discharge, masses, and the zone of transformation, which is where we would be doing the pap smear. And then you'd also want to assess for any change in color or distribution of or any secretions of the vaginal walls. And you would also want to obtain gonorrhea and chlamydia specimens as well. Then by removing the speculum, you would place your thumb on the lever and loosen the adjuster all the way. And you would continue removing it until the cervix is out of the visual field, and allow the vaginal muscles to close the speculum upon removing it at the same angle that you inserted it in, and you don't want to remove it too slow. Moving on with the pelvic exam, you would want to lubricate the first 2 fingers of your dominant hand and introduce your touch again, and use your non-dominant hand to separate the labia and place the 2 fingers at a 45-degree angle towards the coccyx, and assessing the cervix in that way. So you'd want to palpate the cervix, and then you'd want to rotate it to assess for any masses and cervical motion tenderness. Then you'd want to place the 2 fingers behind the cervix and apply gentle pressure to help stabilize the uterus. And then with your external hand, you'd want to place it on the abdomen to assess for the size, shape, contour, and mobility of the uterus. Then you'd want to move your fingers to either the right or left side and apply strong upward pressure to assess the ovaries. With your external hand, sweeping down along the abdomen to see if you can palpate the ovaries, and you'd want to assess for any pain, enlargement, and mobility on each side. And it's important to note that some ovaries are usually not palpable. Then to assess for the pelvic floor muscles, you'd want to ask the patient to squeeze their pelvic floor muscles to ensure adequate contraction while your fingers are still inside. And you'd want to ensure that they are not using any external muscles like the abdominal muscles or their legs to do so. Then you'd ask the patient to bear down like they're having a bowel movement and look for any bulging from the anterior aspect of the vagina, which would signify a cystocele, or any bulging from the posterior aspect of the vagina, which would signify a rectocele. Moving on to the andrologic exam, you'd want to prepare the patient for the exam as well. First, you would start by inspecting the penis, the body, the glands, and the root, and look for any abnormal discharge from the urethra or any lesions that you may see upon inspection. And then introduce your touch, and then you'd want to squeeze or compress the glands between the index finger and your thumb to observe for any discharge from the urethra. Then you'd want to move on to palpating the shaft of the penis with the thumb and the first 2 fingers, noting for any induration or tenderness. Next, you'd want to inspect the scrotum and lift it to make sure you're seeing all of it, and note the hair distribution, any lesions or scars, any swelling, lumps, masses, and asymmetry. Then you want to palpate each testes between your thumb and first 2 fingers to assess again for any masses or tenderness, and you'd want to note the size, shape, and consistency, and palpate the epididymis for the same things as well. Then you'd want to assess the inguinal regions for any bulging areas, any asymmetry, and then palpate for any inguinal hernias on each side. Moving on to the digital prostate exam, you would ask the patient to lie on their left side, and first you would want to inspect the perianal area for any lesions, ulcers, inflammation, rashes, and excoriation. And then you'd want to examine the anus and the rectum before performing a digital prostate exam to assess for any hemorrhoids or any signs of a sexually transmitted infection. Then you'd want to lubricate your first index finger and gently insert it into the anal canal to start with the digital prostate exam. First, you'd want to ask the patient to squeeze the external anal sphincter to assess muscle tone. And then you'd want to insert the finger as far as possible to assess the rectal surface by rotating it clockwise. And that's assessing for any masses, irregularities, or induration of the rectal wall. Then by rotating it counterclockwise, you should be able to feel the prostate gland and note the size, the shape, the mobility, and consistency of the prostate, and identify any nodules, tenderness, or asymmetry.